for junkies, and all kinds of things. Some which may be okay, some which people might find objectionable. Because we're no longer buying medical care, it's all lumped in there. So the dollar we spend, remember, 20 cents is gone, so we've got 80 cents left. 20 cents pays for stuff like maternity and like contraception, things that I might not want, okay, but I still have to pay for it, okay? So my dollar went from $1 to 80 cents to 60 cents, and probably really to 50 because I'm paying for other people's care, because I take pretty good care of myself. And so all of a sudden my dollar's eroded. Once it goes to the doctor's office, I have a client in Florida, two doctors, family practice. Their total clinic revenue is $2.86 million. The doctors only make $185 each. That's less than 13% of the total revenue. So once my 50-cent dollar goes to that doctor's office, they're only getting about 7 or 8 cents out of every dollar. So the doctors are only getting 7 or 8 cents. Okay? Who's getting the rest? All the Medicrats, all the middlemen in government and private that do the pricing and repricing, and all these people that don't need to be there if you were dealing directly with the physician. Okay? So those are the problems. Now, getting back to the exchanges, the Cato Institute found that first of all, let me ask you questions. Anybody ever heard the expression state-run exchange? Has anybody ever heard state-run? Okay. It's not run by the state. It will not ever be run by the state. It's regulated by government. So it's not, saying, oh yeah, if Iowa sets it up, it'll be state-run. No, it won't. It'll be state-funded. It'll be state-funded, but it won't be state-run. So what they found is that if the state sets up an exchange, then that exchange, number one, it's a data collection point. They're going to collect all of your statistics, your date of birth, your bank account number, how much money is in your account. They're going to see your health status, all of your health records. They're going to have your government tracking number on file. They're going to have all that stuff on file, and how many guns you own, and all this other stuff that they're collecting through the central data point. That exchange will be able to hand out at the point of sale, it'll be able to hand out the subsidies. The subsidies for people earning less than $92,000 a year for a family of 4. They're going to be eligible for a government subsidy. Okay? $92,000 for a family of 4, that's not bad money. But they're going to get subsidies, and that's going to be handed out through the state exchange. The other thing, and this is very, very important, I noticed as I was driving through Iowa, and I've been to Iowa, 4 times in the last 2 months, working with Stewart Memorial Hospital in Lake City. I've noticed something really, really curious, that there's a lot of businesses set up just across the border, okay, of Iowa, okay, and they're kind of just on the outskirts. I'm wondering, why is that? Well, one thing, if the state of Iowa, or any state for that matter, sets up an exchange, the other thing that they will do, companies with 50 or more employees are required to offer insurance to to 95% of their people. They're required to. And it's required to be a compliant plan that is affordable and costs less than 9.5% of their salary. But if it costs too much, they're going to charge a 40% tax on that health insurance. If it costs too little, they're going to be fined $2,000 to $3,000. So it has to be just right. Deductible has to come down to $2,000, and the price is going to go up, and it can't go up too much. Now, if the state sets up an exchange, any business with 50 or more people that doesn't offer these compliant health plans will be fined between $2,000 and $3,000 per person. Okay, after the first 30 people. So a company with 50 people will be fined based on 20. A company with 100 people will be fined based on 7. If the state says, no, we're not going to set up an exchange, and the Fed comes in and sets up an exchange, that exchange cannot levy those fines. So if Iowa says, we're going to set up an exchange, and South Dakota says, we're not going to set up an exchange, where are the jobs going? To South Dakota. Okay? So setting up a state exchange will be a huge job killer. Huge job killer. 15 states have passed healthcare freedom acts. In Iowa, the House passed a healthcare freedom act. The Senate hasn't, but the House has. Okay? If that act were to pass, it would actually be illegal to set up an exchange. It hasn't passed yet. Maybe it will this session, maybe it won't. I don't know. Okay? But having the state set up an exchange is going to send companies out of the state. And we don't want that. We don't need that. So what are the solutions? Well, the solutions are really obvious. And you know, Dr. Hieb talked about a lot of them. The destruction of the doctor-patient relationship is a huge one. Not allowing doctors to compete based on quality and price is a huge one. So what we need to do is we need to turn back the clock to 1972, actually maybe even before 65, actually maybe even before 45, actually we could keep going back. We need to set it back to when medical care was the product. That needs to be the product. Now, insurance itself is not a bad thing. If you have catastrophic coverage, that's fine. But the third-party prepaid health care that we have now that resembles insurance, that they call insurance, is not the thing to do. Now, in Lake City, I've been working with Stewart Memorial Hospital. They've got 142 people on their health plan out of 286 employees. Their healthcare costs were spiraling out of control. Their deductible was up to $6,000 and $12,000, and their premium was unaffordable. And they were in what I call a death spiral. We redesigned the whole plan from the ground up, saved them, they were going to get a 34% increase. We gave them a 42% decrease, saved them $840,000 a year by applying market principles, by making medical care the product. Okay? There's a lot of other things we did. So it's actually manageable in many cases, okay? But the traditional status quo, you know, when you try the same thing time and time again and expect to get different results, what happens? You know, who said that? Right, okay. So it's not going to work. So we have to stop the exchanges, okay? That's very simple. And if enough states stop the exchanges, if enough states say no, the feds haven't allocated money to set them up. And the exchange is the beating heart of Obamacare. So if we stop the exchanges, that's the distribution system. Okay, that's the distribution. So that's the best thing we can do. Supreme Court let us down. The election didn't change anything. So stopping the exchanges. Okay, now, is there anybody that thinks there's any part of Obamacare that's good? Let's talk about the good parts. Are there any good parts that are worth keeping? Can anybody name a good part? I'm sorry? No? Okay. Well, and Dr. Hieb talked about repeal and replace.